Hello, this is Gary Colton. I'm going to be doing the voiceover for this presentation on our project. Does perceived personal control predict beliefs and behavior intentions related to COVID-19? By way of introduction, the COVID-19 pandemic, obviously we're in the middle of it, hopefully a little past the middle of it, but it is the most serious global pandemic experienced since the 1918 so-called Spanish flu. That pandemic, it's estimated, resulted in the deaths of 675,000 people in the United States and 50 million people worldwide. Major impacts of COVID-19 have been seen worldwide in a number of areas. At least four of those areas: mortality, fatalities, the economy, mental health, and education. We are primarily focused here on the first one, mortality/fatalities. In terms of fatalities from COVID-19, the World Health Organization estimates that to date, more than 532,000 people in the United States have died from complications of COVID-19, and more than 2.6 million people have died worldwide. We have one very major advantage during the current pandemic over people in the 1918 pandemic, and that is the availability of vaccines. There are currently 3 approved for use in the United States and at least 3 others approved for use outside of the United States. During the 1918 pandemic, there was only very basic interventions like quarantine, isolation, pushing, personal hygiene, those sorts of things. As vaccines were being developed in the year 2020, it became evident that a significant percentage of adults in the United States were hesitant to be vaccinated. And this is one impetus for the study, was to take a look at the relationship between hesitancy to vaccinate and several other variables, which we will discuss on upcoming slides. In the present study, we examined several aspects of adults' perceptions of control about contracting COVID-19 and the relationship of those perceptions to their intention to be vaccinated against the virus. Our hypotheses are presented on the slide. We predicted that lack of control would be positively correlated with 2 perceptions and 1 behavioral intention. The first perception was of the severity of the disease. Second perception, susceptibility to the disease. And the intention was the intention to be vaccinated, all positively correlated with lack of control. And our hypothesis 4 was that perceived personal control would be negatively associated with susceptibility to the disease. There were 351 participants in the study. They were all recruited via MTurk, short for Mechanical Turk, Amazon's crowdsourcing platform. They were all compensated at $10 per hour, and I'll let you read the rest of that information. Our study was conducted as an online survey. The items are presented here. The study was conducted as an online survey. You'll note here that vaccination intention consisted of 2 items. The rest of the items are presented here. Please note that perception of disease severity was measured using 4 items that were combined. Our results are presented here. As you can see, lack of control was positively correlated with perceived severity of COVID-19, also perceived susceptibility to COVID-19, and lastly with the intention to vaccinate against COVID-19. Perceived personal control was negatively correlated with disease susceptibility. All of these correlations reached statistical significance. In terms of discussion, first off, lack of control was positively correlated with perceived severity of the disease. In other words, the stronger participants' beliefs that there were many events out of their control that could result in them getting the virus, the more severe they perceived the disease to be. So hypothesis 1 was supported. Next, lack of control was positively correlated with perceived susceptibility to the disease. In other words, the more strongly participants believed that there were many events out of their control that could result in them contracting the disease, the greater they perceived their susceptibility to the virus to be. So hypothesis 2 was also supported. And finally, regarding lack of control was positively correlated with intention to vaccinate. In other words, the stronger their perception that there were many events out of their control that could result in them getting the virus, the greater participants' intention to be vaccinated. And finally, perceived personal control was negatively correlated with disease susceptibility. And just a note, in this context, perceived personal control is probably best viewed as equivalent to self-efficacy. The greater the perception that their regular personal habits would prevent them from contracting the virus, the less likely participants felt they were to catch the virus. So hypothesis 4 was also supported. In closing, we have a few recommendations for future research. First off, we'd recommend collecting data on compliance with CDC guidelines. We would expect that self-reported compliance with those guidelines would be negatively correlated with perceived personal control. Also, getting vaccinated at the time that these data were collected, vaccinations were not available. They are currently being administered in the United States. And this would enable the researchers to move from behavioral intentions to actual behavior. We'd predict that actually getting vaccinated would be positively correlated with lack of control. Our final recommendation for future research is that data also be collected on political affiliation, which has been identified as a strong predictor of vaccine hesitancy. And here is our reference information. This concludes our presentation. Please feel free to contact me with any questions at the email address indicated here. Thank you for your interest.